Okay, guys, in this video, we will cover about meniscus injuries in the knee. It's a very common injury after ACL tear, majority of the time in an athlete who has a lot of pivoting motions, cutting, and those type of movements in the knee typically leads to meniscal injury, and majority of those are tear in the meniscus, which bucket handle tear. It's a very common meniscus injury, which requires surgery. But um, you as a provider, as a first exposure, for example, if patient comes in to you and trying to get help from you to find out what's going on with the knee, you have to do your evaluations to find out if the meniscus is healthy or not. There's a few things that we call the yellow flag towards the red flag in the office that kind of like shows lights to the provider that this might be a meniscus injury. Um, Usually clinical manifestations like patient presentations, it's going to be lack of flexion in the knee. Going up and down the stairs is going to be painful. Catching and clicking is another sign that patients usually complain of if they have meniscus injury. In an acute phase of meniscal injury, about day 1 to day 4 or 5, there's going to be mild to moderate swelling in the knee depending on how big the tear is. But usually swelling is an indication that the structure in the knee, like meniscus, would be injured, and it has to be within the joint line. Right in the joint line where the tibia plateau is, we have our meniscus, which femoral condyles sit on those tibia plateaus where the meniscus are laying. Patient usually have tenderness to palpation also on that area. So we're looking for swelling, number one, and we're looking for joint line palpation as part of our palpation and observation, which is inspection of the patient. Then, if patient is hot for those signs, we do our orthopedic examinations. Tests like McMurray's test, Tesley's test, or Apley's compression tests, which are about 70 to 80% specific and about 80 to 90% sensitive tests to rule in or rule out meniscus derangement with the patients.